Hello again, it's Kelly McClendon presenting the third and final part of the overview of AI in healthcare foundations and trends of AI compliance. There's an introductory video that talks about my biography and some of the assumptions that these slides are based upon. Feel free to take a look at that. It'll also be posted in this channel if you'd like. And again, this is the third part of three in the overview series. We will be doing deeper dives in the future of all of these subject matter areas. And as they change, of course, posting new material. Today, we're going to look at other government AI compliance and guidance and rules, and AI issues to be addressed, and then a conclusion. HIPAA privacy update, gathering AI authorizations. At the end of part 2 of this series, I posed a question: how to get authorizations for training and using AI in healthcare. And I said that developers of AI have to think out of the box to find out how they're going to get these authorizations. Well, I just learned the other day that Orlando Health, which is my healthcare provider, but I actually have not been back and seen this notice, but someone told me that they are now requesting authorization to use the Nuance DAX AI at registration in their consents package. So privacy officials in the legal counsel must have gotten involved and figured out how the use cases work and wrap them in signed authorizations to ensure HIPAA compliance. I think this isn't really a routine consent like it is with TPO that you might use or not use, up to you whether you get that signature. But this one is, I think, critical to get that authorization anytime you're going to use PHI. Other government agency AI compliance, guidance, and rules. We have oversight of AI from the federal level from quite a few agencies beginning now. Of course, I'm going to lead, I think, with NIST, the National Institute of Standards and Technology. And by the way, this is after the election. We don't know how any of this might change under the new administration, but let's assume for now a lot of this will remain the same. NIST has already provided the risk management framework for AI. That could be updated, but is probably going to go forward, in my opinion. The National Artificial Intelligence Initiative Office, who knows, Office of the National Coordinator for Health Information Technology. Clearly, ONC has a say in the use of AI in healthcare with the Cures Act and certification of EHR platforms. I don't see that changing, although exactly what they do, what might get enforced, that could change. HHS, nobody knows where changes might happen there. The National Artificial Intelligence Advisory Committee, Coalition of Health AI, which is a less governmental and more of a coalition of different groups, the U.S. Government Accountability Office, and the Federal Trade Commission. All of those, again, could be implemented or they could be pulled back or not enforced or not given budget money. So we'll have to see, but the point really is there are a lot of agencies that are going to overlap responsibility and try to cover AI with regulation as we go forward. So just expect that that's going to happen. The exact players, when and how, that may shift some. AI governance commercialization. There was an article called The Secondary AI Land Grab in Healthcare to Commercialize Governance. And it's an interesting article. There's a link at the bottom there. what I most liked was the list that it generated of the different groups here that are taking positions in the healthcare AI governance marketplace. Uh, and a lot of this is commercialization. It is all commercialization. So it's not necessarily the government's efforts to regulate, but different coalitions. Again, there's your Coalition for Health AI, and there's the Joint Commission. But there are others as well that could be lending support to different areas in AI governance. So again, AI governance, which is the theme of this presentation, has its own various stakeholders and groups working on governance for the AI. Again, governance means control, and all of them believe that there should be some controls. How they'll differ, how they'll be implemented, that remains to be seen. New Cures Act Final Rule HTI 1, Transparency in the Cures Act Final Rule. So first thing is to remember that the HTI 1 rule only applies when AI is provided by a certified EHR or EHR IT module per the ONC certification process. This rule does not apply if it is not used in conjunction with a certified EHR or EHR module. This is one of the first regulations that has come from the federal government about AI, and it's illustrative of other regulations that'll come. It's implementing the provisions of the 21st Century Cures Act. It's really focusing on decision support interventions and the transparency behind them. And so decision support interventions being when you use AI to help make decisions about patients. It's part of the clinical process typically, and will need to be transparently done. They need to publish when it's being used, details about the AI, all in clear and understandable language. So that's important for governance to be understanding that for the AIs within your certified EHR is going to have to be very transparent. This holds in general for AI, but the law of HTI 1 rule requires transparency, and there's numerous elements to this. There's also new interoperability and certification, including certification criteria for AI. And if a certified EHR does have the AI, well, the certification criteria for that AI are available in published form. So that's good to know for governance, that you're going to be able to go to the vendor and get the information about the certification of the AI. And again, that supporting documentation that you're going to want to put in your cataloging and your knowledge base, and what you're going to do to monitor and go forward on your AIs. But you have to know a lot of this information is a part of the governance data catalogs. And so it should be published and available for these certified products more than perhaps you will get out of other vendors about their AIs. So if you want to request the certification information about AI within the certified EHR, the public can access certain information about the certification results from that link below the first bullet here, the ONC's Health IT Certification Program. The ASTP, which is also ONC, the Office of National Coordinator Healthcare IT, ASTP being the new acronyms for it, publishes the list of certified health products list. And again, there in your blue text are the rules and the insights into performance and validation of AI systems and the transparency requirements that developers have to use. So again, requesting information about the AIs is a part of your governance activities. You have to be cataloged and know what your AIs are built out of and on. And these are ways to get at that. I use Copilot AI to produce this list. You could do the same kind of thing, or you can use the links in these slides, which we're happy to send to you. Some issues to be addressed here in overview form. AI liability. There's a Texas Attorney General AI healthcare action using the consumer protection law. And I think that's what we're going to see a lot of right now on enforcement against AI, is that they'll use a more general consumer protection law and then look at things like transparency or misrepresenting what the AI can do, maybe not doing enough cataloging, inventorying, inaccurate metrics and measurements, things like that could cause these consumer protection laws to get triggered. And so you may see relatively similar to this Texas AG action in this case is really about transparency, telling companies they have to abide by their privacy commitments. They can't surreptitiously change the terms that they publish. And so it's important for responsibility and transparency. Again, for governance, that's just the same drum we're beating over and over again. Failing to provide appropriate notices on the AI or making exaggerated or misleading claims about a technology's capabilities really can cause regulatory risk and legal liability at both federal and state levels. So be very careful to be responsible in your write-ups about your AIs in use. Work with your vendors if necessary to get that information for such notices and write-ups, and be very careful. Consult legal counsel when doing these advisories and notices about your AI use, so that you don't run afoul of especially consumer protection laws. There'll probably be specific AI laws on this as well, which we think we're seeing, but in general, the Federal Trade Commission type actions will probably follow these types of trends. So, we keep saying oversight of AI is mandatory because AI hallucinates in unexpected ways. Maybe it makes up a diagnosis code. Maybe it grants prior authorizations when it shouldn't. But it can tend to look like it's presenting facts with authority. So why do they hallucinate and make mistakes or reduce their own accuracy in their output? Well, many of the factors that cause hallucinations and inaccuracies are based on the models which the AIs rely upon and are trained to take all this vast tranches of data and make some sense out of them and analyze them. But remember, this data is made up of lots of different factual materials, government regulations, but also social media and the Internet of Things, which may be highly or wildly inaccurate. They take all of that in. So is hallucination by these systems surprising as a risk? Probably not. There's so many examples of reasons that AI must be overseen and managed by humans that we're even seeing the states and different, even federal regulations coming along that are going to limit the use of AI. And in the case of the slide here, it's showing in this article that California plans to limit the use of AI in utilization management. And that's because they've seen some inaccuracies, and there's going to be a tendency to want to just let AI do a function such as prior authorizations, or replace utilization management with humans with AI. Well, this law is going to limit that and require human oversight and prohibit straight use of AI with no human oversight. That it's still going to be the responsibility of a provider of care to generate the utilization requests. So it's certainly of note that the laws are tending to skew towards showing that human oversight is not just recommended, it's mandatory. Huge power and infrastructure requirements to run the AI and language models. I used the report, but I also got this artwork from DALL-E out of Copilot showing, big solar arrays and hydroelectric arrays with technical factories and things. So, the infrastructure to run the actual AI processors takes a lot of electricity. I know someone doing it in their garage, and it's added $100 a month to their electricity bill to run their computer. So, it does eat up a lot. And think of these giant data centers. How are you going to power them? And how are you going to train these billions and trillions and up to the exabyte level tranches of data that have to be incorporated into these AIs? So all of those are issues that we have to address. Energy consumption to run the servers. How are you going to have that? Are you going to use hydroelectric or solar or fossil fuel? OpenAI has reportedly announced plans to bring global investors together to spend tens of billions on AI infrastructure in the United States. In my opinion, more is better as far as AI infrastructure in the US. And, they've got planned projects including data centers, turbines, generators, semiconductor manufacturing, and so forth. And that's exactly what I prompted Copilot and DALL-E to build my image from, and that's what it resulted in right there. That's pretty cool. PHI linking into the internet through AI, another area to be addressed. It's something to always consider. And the reason AI must use privacy and security tools and methods that we've developed to train models and to do other activities when AI is because the risks are huge, and at present there's little regulation. You do not want protected health information, patient information leaking into the internet through the use of AI by making prompts with that information, and maybe it goes into the training model, maybe it can't be brought back out again. Now, that isn't required. There are ways to architect around that leakage, but you're always going to be looking for ways to prevent personal information from healthcare from getting into the wider internet from the AI usage. And that's what HIPAA is going to be all about here, is making sure that you protect the correct information, use the least amount of it that you can, just like we've always done with HIPAA, but that we're going to have to now flex the rules to make sure they encompass using AI. And this is where you start getting into needing some experts in how the AIs work. You're going to have to deal with the vendors. if you're making a prompt and using protected health information in the prompt and you're asking the AI something, or you're training the AI on some group of your patients to do something, all of that is going to have to be carefully documented. It's going to have business associate agreements in place, and you're going to have to map out all the uses and make sure that the AI is architected not to allow leakage of the personal information back into the internet. So, in conclusion, remember when CPOE, computer-based physician order entry, generated fear for many? Would HI or HIM be replaced by automation? Would other staffing be replaced by automation because CPOE went online? That didn't happen. But a lot of the tasks related to EHRs and the CPOE evolved, and that's what they did. Remember when computer assisted coding was going to replace coders? And I'm talking about over the last 20 years. That didn't happen. AI is going to assist, but coding will still evolve with human interaction. If you can't get prior authorization in in California, because the law says that a provider has to be in the mix, I'm pretty sure coding is going to end up sort of the same, in that you're not going to be able to just use AI without human intervention or human action. And so I wouldn't be fearful. I would embrace it and become an expert in it to the extent that you can. AI is not going to replace the human processes. It's just going to streamline them so more tasks can be accomplished and accuracy improve, so our workloads will be lighter and it'll be a better world. That's funny, isn't it? Not really. Our workloads will never be lighter, but you may do other things. AI can be used to assist in certain areas, and I think improve accuracy in other areas. It's very difficult to summarize a chart in an EHR right now. You need software to help do that, and AI can perhaps do some of that and help the coders understand what really is going on in all the vast amounts of data some of these records now contain. So don't be afraid of the unknown. Learn to use it to your advantage. All over the place, we're hearing about AI because it's a buzz. But there probably will be a downturn in the buzz, because after tech comes out and starts to be ingrained, then fear drops off in some, and you'll hear a little less about it. But the AI's potential is just being tapped, and it's not possible to even predict where it will go. AI is a disruptive technology because it can be very scary when change like this is introduced in both seen and unseen ways. And as with anything that's new, it's hard to understand what to know and how to apply it to your workplace and your roles. But you're not alone. We're all in this together. Nobody knows really more about it except those that study it, and there aren't enough people like that. Attention is being given to the AI by the regulators, by the standards makers like NIST, others that can apply controls. That is a known quantity that needs to be done, and there is progress being made on that front. Our role is to continue to learn, to assess how AI impacts the privacy, health information, and compliance in healthcare in your organization, and get your organization's learning programs, responses, controls, notices, all of those things, policies and procedures in place and operational. There's lots to be done, and it will not stop evolving for the foreseeable future. So there's, I think, not reasons to be fearful, but to embrace the technology and what is clearly inevitable. All right, well, we've reached the end of the presentation. I just would like to remind our viewers that my company and I have created a new AI risk management assessment. It's now available, and I'm happy to discuss that with you. If you would like to reach out to me at kmcclendenip@outlook.com, I would be happy to talk to you more about helping you with your AI assessment for governance purposes or related topics. We also could talk about privacy if you wish. I know a good bit about that as well. So thank you for your attention, and I look forward to producing more videos as we go forward in deeper detail.